Welcome back to Plastic Surgery Decoded, the podcast designed to help you better understand plastic surgery. We take the mystery out of it in plain language. You'll find it interesting and useful whether you are already planning a procedure or you're just curious. I'm your host, Dr. Regina Nouhan, and we are now into Season 5 of the podcast. After you listen to this episode, know that you can explore and enjoy many other topics, either through your favorite podcast app or through the website at plasticsurgerydecoded.com. The first 40 episodes, or Seasons 1, 2, and 3, comprise the Plastic Surgery Decoded Classics, with my singular voice covering cosmetic and reconstructive procedures, skincare, and general questions about plastic surgery. The remainder of episodes, Seasons 4 and 5, are interviews with my colleagues around the country to help you learn about the subject. A great variety to choose from. Remember that this podcast reflects my experience and opinion, as well as those of any guest interviewed. It is not intended to provide medical advice, nor is it a substitute for a formal consultation with your physician. So come along with me as we explore this ever-growing world of plastic surgery. Let's go! Rhinoplasty, or nose reshaping surgery, is consistently one of the most popular surgical procedures in the field of plastic surgery. But as common as it is, it's perhaps one of the most misunderstood procedures. There are important things to know that might not be so obvious or intuitive to potential patients. And that's what we want to clear up today. So who better to help with this than someone who performs many of them and is passionate about the artistry of it, someone who uses best practices to achieve the desired outcome. Dr. Jeff Markey is in conversation with us today on this episode. Take a listen. Well, I'm pleased today to welcome Dr. Jeff Markey, who is a facial plastic surgeon in private practice. Welcome, Dr. Markey.
Hi, Regina. Thanks for having me.
Oh, great to have you. Well, as we start out, would you tell us where you're practicing right now and where you trained?
Sure. So I am back home in Kansas City. That's where I grew up. And I went to med school here as well at University of Kansas. And then after I graduated, I did ENT, head and neck surgery training at the University of California in San Francisco. So I got to live there for 5 years and be young.
Nice.
And, take a motorcycle up and down the hills, which was awesome. When I wasn't at the hospital, you know about that. And then I did a fellowship in Portland, Oregon, doing facial plastic surgery. And then after I graduated, my wife and I moved to New York City. And I was an assistant professor at NYU for a little while. And then when she got pregnant, our apartment felt very small all of a sudden. And so we moved back to where I'm from in Kansas City. And I've been here since the start of COVID, really. So now I'm here practicing, and here we are.
And doing great things.
Yeah, that's right.
And that's right when I retired. So perfect timing.
Right.
Well, you're practicing here in Kansas City. What type of cases do you typically do?
So it's only facial plastic surgery. So my part's shoulders up. It's a lot of rhinoplasty, which we're going to talk about, nasal, cosmetic, and functional surgery. It's a lot of rejuvenation surgery of the face and the neck. So that's a lot of face and neck lifting, eyelid surgery, a lot of fat grafting, brow lifting, all those things, lip lifts, things like that. We do otoplasty of the ears. I used to do a lot more in the way of trauma reconstructive surgery, after cancer resections, Mohs surgery.
Mm-hmm. Or people in injuries.
Yeah, I used to cover call at Research Hospital, actually, when I first came here, doing gunshot wounds and those things at 2 a.m. But it's kind of glided into more cosmetic surgery, which I would say rhinoplasty, rejuvenation surgery, and those kinds of things.
Gotcha. Well, it certainly sounds like rhinoplasty or nose surgery is a favorite procedure of yours. And I think to be very good at rhinoplasty, you have to do a lot of them and you have to enjoy them. What is it that you love about rhinoplasty?
I love the three-dimensional contouring about rhinoplasty. I love that.
That's a good point.
Yeah, it's complicated anatomy. It's the focus, I think, for many patients. It's also an essential piece of our aesthetic character, I would say. And that is, I think, when I think about all my friends across the country who I trained with or are off doing rhinoplasty, I can almost tell their kind of signature rhinoplasty and what they're doing, and everyone gets to have a little bit of their own character into their results. And I think that our patients appreciate that and choose their surgeon based on that. It's a very nuanced procedure, I guess you could say. So it's a long-winded answer, but I love it because it's hard,
Yeah. it's a challenge.
Yeah.
And I love the fact that you talked about nuances because it allows you to be so artistic, really. It's one of the epitomes of being a plastic surgeon is being able to do something artistic with the nose, basically.
Yeah.
It's a great procedure that has continued to evolve over time, but there are some concepts about it that I think are frequently misunderstood by the public. So today we're here to help listeners understand more about rhinoplasty, both the basics and some important nuances, as you say. Could you tell us maybe the first important thing you want listeners to know about rhinoplasty?
Yeah, I think one of the most important things to think about when considering rhinoplasty, recovering from rhinoplasty, or talking about it generally is the nose obviously is more than just an aesthetic structure on our
Yeah.
face. The nose is a functional organ, it's a sensory organ. It has a lot of biofeedback, respiratory benefits, of course, and so we need to think about that when we're sculpting the nose, when we're making aesthetic changes to it. Because the patients need to not only like the shape of their nose when they've healed, it needs to work. They need to have
Yes.
that improved exercise tolerance, better sleeping, all the many, health benefits that go along with breathing well through your nose, which I think is becoming more and more commonplace. And so we think about that too when we're doing the surgery, is it's more than just refining the bridge or sculpting the tip of the nose. We need to make sure that functionally that patient benefits as well.
Yeah, that's great. So, your first point is basically that the nose is more than just for looks. It's
hmm
got a function. And so, we
hmm
have to be thinking of that when we're intervening and doing something to change the appearance. So I think that's an excellent point.
We see that sometimes too. Patients have had prior rhinoplasty where aesthetically it may be the prior surgeon, it's really been beneficial as far as the aesthetic changes, but if they're not breathing well through it, all is lost. So you have to make sure
Right,
that both boxes are checked as the patient heals
right,
up and
right.
as they're going through the recovery process.
Very good
Yeah.
point. It does seem that most often patients come in wishing to change the appearance of their nose. Do you find that to be the case? And then what are some of the common requests or concerns that people may have?
Yeah, that's a great question too, because with rhinoplasty, and probably like with a lot of the surgical procedures that you did, there's not one ideal result where every patient says, this is exactly what I want. And we know that from an engineering perspective, we need to get every patient to that final result. Everyone has kind of a different ideal nose, and especially for men and for women, of
Yeah,
course.
tell us about the difference there.
A masculine nose, again, it starts there at the bridge, kind of between your eyes, and a masculine nose would extend straight forward and downward towards the tip.
Hmm.
Wouldn't be much of a slope to it, it'd be flat. And then the tip would sit a little bit lower, would curve back around towards their lip, and so that angle between the lip and the tip of their nose is maybe a little bit above 90 degrees, things that we have to think about when performing rhinoplasty.
Hmm.
Now, a more feminine appearance would be, again, that starting point between the eyes, but now there's a subtle slope to it that extends down towards the tip of the nose. And the tip is going to sit up a little bit higher. It's going to be a little bit narrower. It's going to be more of a graceful curvature from the lip going up towards the tip. And it looks more feminine. It's cuter that way. And so we have to think about that too, because a lot of patients want their nose somewhere on the gradient, but not so far to the left, masculine, not so far to the right, feminine, or somewhere in between.
Hmm.
Many patients come in with photos, of celebrities that they like, or they do morphing of their own on the computer with Photoshop. And I actually think that's really helpful because they don't know, oh, I want my nasal frontal angle to be 105 degrees. They don't know the
Sure.
terminology that you and I know. They just know I like Scarlett Johansson's nose, and then they ask me, is this a feasible thing? And I say yes or no or maybe, that kind of thing. And so it is very customizable, and that makes the initial visit with the patient a little bit longer because we're doing morphine on the
Yeah.
computer. We're trying to make sure that I understand, okay, what is it that I should put up on the wall in the OR when I'm doing the surgery to make sure that you and I are on the same page and you wake up and you're happy with the
Yeah.
result. And it's very different from my first surgery today at 7:30 than it was from my rhinoplasty at 10:30 and so on. So,
Gotcha.
but I enjoy that part of it. Yeah.
Speaking of computer morphing, it's a great tool to have. Do you think it promises more than we can deliver sometimes? Is there a concern that, a patient is going to expect to look exactly like this computer morphed picture and maybe it just doesn't turn out that way? What do you find with computer morphing?
Absolutely true. I think it is more than we can deliver because it would be great to rearrange the tissue that way, the cartilage, the bone, the muscle, it was the same as rearranging pixels on a screen.
Yeah.
And so that's why it can never be a promise to the patient. It has to be viewed, and very explicitly so, as a communication tool.
A guide.
Exactly. And luckily, I don't know if it's practicing in the Midwest or just the way that we treat patients. Patients are really accommodating in that way, and very rarely do we have a patient who is just swollen 3 days after surgery and holds up that picture, angrily saying, "Why does it not look like this yet?" That kind of thing. Everyone kind of understands that this is the common goal we're shooting towards, but I'll do my best, and patients have to go with the
Yeah.
flow. And luckily, in the end, we're usually both very
Yeah. And the
happy.
human body's a little unpredictable anyway. And so
Oh, especially with rhinoplasty, I feel.
we all heal a little differently, and you just can't, there are a
Yeah.
lot of factors that go into it. So,
I went to a conference in Miami a couple weeks ago, and there's a Turkish surgeon talking, and one of his slides was this Venn diagram where one circle was the surgeon, one circle that partially overlapped it was the patient, and another circle was healing.
oh, right.
And they all kind of intersect in the middle. And it's so true that no matter what the patient does, if they do a perfect job healing, following the rules, no matter what the surgeon does, if technically the procedure goes perfectly well, there's still this third thing, healing, that has to happen, that is out of their control, that both of those first two circles try to control. But that's really with rhinoplasty, has to go, and we have to make sure that both the surgeon and the patient understand that we are in this together,
Yeah.
but we have to, we're trying to control the uncontrollable in some ways.
Right. Like much art. I mean, you can strive for a certain end result, and it will not always be quite like that. And you
Right.
have to accept a little bit of the factors that are not in your control.
Hmm.
Well, curious, these days, do people come in more concerned about tip of the nose shape or the width of the nose or the straightness, if you will, for the listeners, the straightness of the dorsum or the top of the
It's a good
nose? I'm
question.
curious if there have been trends that have changed over the course of time, maybe from your training to where you are now in your practice.
Oh yeah, definitely over the course of time. I mean, I think I'm lucky to practice in the area that I am now, but especially when I was in New York, you could go to the Upper East Side and see these old ladies who had something called the Goldman tip done.
Yes, tell us about that.
The Goldman tip was a plastic surgeon, the Upper East Side of New York, Dr. Goldman. He would do this signature rhinoplasty technique where the patient would, I imagine, be asleep, and under anesthesia, he would transect the cartilage, meaning cut it in ways that I would never do now. It's a
Hmm.
very aggressive maneuver,
Hmm.
and he would expect it to just scar in a way that it narrowed and kind of looked pinched. This is probably what, 50s, 60s maybe.
Yeah, I'm sure a lot of people have seen people with that shape of their
I'm
nose.
sure you could, yeah, Google the Goldman tip.
Yes.
So again, the one, I think the form of it was trendy, was
Hmm.
not a perennial thing. Number two, the function was very harmful in a lot
Sure.
of ways. The nose collapsed down. It wasn't very helpful as far as the air passages. And so that has since changed. And I think from the 90s on, most patients are hoping for a more natural result. And we definitely guide them that way, because even if you have a 19-year-old coming in looking for a rhinoplasty based on her favorite celebrity or something, well, she's going to have this nose at 29 and 39 and 59 and so on. And so we try to give them these timeless feminine features that we call timeless. Who knows what will
Sure.
happen? But
Yeah.
also recognizing that a natural appearance to me is not only the most helpful aesthetically, but also it means they're functionally working the best.
Hmm.
But you want it to look, for our female patients, as symmetric as possible, feminine, attractive to them. And for men, you want it to be straight. You don't want it to have a lot of asymmetries to the nostrils, things like that. Those are timeless as well. But
Yeah.
I think patients nowadays are not going for crazy over rotated tips and over scalloped dorsums and things like that.
Yeah.
And we wouldn't offer that anyway. So
Well, speaking of men and women, what percentage of female rhinoplasties versus male rhinoplasties do you think you're doing?
I bet it's 4 out of 5 female to male.
So 80-20%. Yeah.
Still, we do a lot of rhinoplasties, so still do a lot of male rhinoplasties too, because that's 20% of a large pie, but mostly feminine rhinoplasties. But they are really different aesthetic goals between the two.
I have to check the stats, but at one point, and I think it was during COVID when everyone was, doing Zoom calls and seeing their nose, which can be distorted in a selfie kind of thing.
Uh-huh.
But I think rhinoplasty was the top male procedure for the year, something like that.
I believe it. I mean, those like these fisheye lenses.
Oh, I know. I know. They're just so distorting, and people don't realize it. No, that's not really what you look like. But
I see it myself. I mean, like I'll be on my phone and my 3-year-old daughter will come over and hit like the reverse camera button on my phone.
right.
And then I'll see myself from
You're
like
like,
under my chins, I'm like, oh my God, I got to raise it up above my hair. And then I see my hairline, It's like, just turn it off, turn it off. And
can't
so
win.
everyone has that little itch that they want to scratch, you know what I mean?
Oh,
But
that's great.
yeah.
What about ages that come in for nose surgery? Are you seeing certain, I'm going to call it the age demographic. Where does that fall typically? I'm sure you can have a wide range, but what do you think?
Yeah, I would say late teens, 20s, early 30s is the most common.
Hmm.
Usually like between big stages of life, after they graduate high school, before college,
Oh,
after college, before their first job, these kinds of when they feel
yeah.
kind of reinventing themselves. It's kind of fun to be part of that.
Hmm.
But 30s too, they finally had their third child and they have a minute to themselves to recover from rhinoplasty. That's common. But we've done rhinoplasty in primary rhinoplasties too on women in their mid 70s too. I guess to some extent it's true that our nose does change over time. Gravity pulls the tip down a little bit and things like that. But I love it when they're saying, I've had this nose for 73 years and I'm ready to do something different. It's like you
Oh,
know,
man.
it's a,
73. I love it.
oh yeah, for sure. That was probably maybe 3 weeks ago. And it's a fun moment, they're investing in themselves and they're doing it for, all healthy reasons. And so,
Yeah.
but I would say on average, of course, the median age is in the 20s somewhere probably.
Gotcha.
Yeah.
Okay. That was a great discussion of our first point, and we touched on our second point a little bit, but I would love to know what your second important fact about rhinoplasties is.
I think the second important fact that every patient should know for sure is like what we talked about, where there's no right, correct, perfect answer for what should I be asking for a rhinoplasty. I think a lot of patients think that, oh, I didn't know the terms, I didn't know what to discuss with my surgeon, and so I think there is no right answer. We just want to find out what is best for that individual patient, and it will vary between their best friend and their cousin and their former roommate or whatever. And
That's a good way to put it, actually.
yeah, and that's why we need to use some of these communication tools. That's morphine, that's photos they cut and paste off Instagram or whatever. Or a lot of times now it's them going to my website and saying, I like these 3 results that kind of looked like me, and I would hope
Hmm.
for something like that. That's why I called you in the first place. And so that is really helpful to know that, okay, I think this is in our wheelhouse. We're offering you something realistic, and you seem to understand the risks, the benefits, the alternatives. Let's move forward.
Gotcha. And so basically, what you're saying is there's not a set or standard nose job or rhinoplasty procedure. You don't walk in there and do the same thing each time, even though you're trying to get a little different result. You customize what you're doing to try to achieve that result,
Oh
correct?
yeah, I think like if you look at our before and after gallery, you're going to see a lot of different ethnicities, age groups, genders, etc.
Hmm.
And I think a patient who sees that and ends up calling us is because they found one they identify with, one they like,
Hmm.
but not all
Hmm.
of them because not all of them look like their nose preoperatively or looks like what they want postoperatively. So
Gotcha.
it's complicated that way.
Yes. Let's go back a little bit and talk about some of the very basic anatomy of the nose and then find out just basically, for this particular thing, what you would do to the nose to change it.
The anatomy is complicated, like we talked about, but basically, if you divide it up, say you have the top vertical third, middle third, and the lower third, there's a different structure for each one of those. And then we'll talk
Hmm.
about what we see internally too. But the top of the nose, of course, you can feel it with your fingers. That's bony. So when you
Right.
break your nose, playing basketball or for you, a bar fight or whatever, that kind of
Oh,
thing.
yeah, that's me.
Uh-huh.
Who told you?
Exactly. We know all around Kansas City, we know. But those nasal bones are what's actually fractured, like a bony fracture.
Yeah.
Because when you move down to the middle third, now we're talking about cartilage. Cartilage is more malleable. You can kind of deform your ear and it sort of springs back into place.
Right.
Slightly different cartilage for your nose, but still, that's your upper lateral cartilage there in the middle. And then your lower part of your nose, that's the tip. Those are two paired cartilages. The tricky part with the tip of the nose is that it's sort of floating in space. It's held in place by some ligaments, little
Hmm.
fibrous bits of tissue that connect it to the other bits of cartilage in the bone of the face. But that is the part that is really important to think about. And if you look inside the nose, the reason why you can't pass your finger into your left nostril and out your right nostril is because of your septum. Your septum is the divider between the two nostrils all the way back to the
Mm-hmm.
back of your nose, called your pharynx. And that is also kind of like a tent pole for your nose, supporting it, projecting your nose out into three-dimensional space. And so,
I love that analogy.
yeah, and so we need to think about that too when we want to take the bridge down or raise the tip up, et cetera. The septum is really the midline support. But internally and externally, those are all the things that we're working with. I would say rhinoplasty at its core is kind of a bony and cartilaginous surgery. So that's what we're manipulating for the most part when we're making changes to the shape of someone's nose.
Well, so again, our second important point about rhinoplasties is that one size does not fit all. So there are
Hmm.
different procedures that you do and different way you do the procedure for each patient based on their particular desires or needs. But in general, could you give us an idea of where the incisions typically might be?
Yeah, sure. So now, again, there are multiple conferences, 4 days long, all throughout the country, probably one going on now somewhere, that
Right.
are talking about just this surgery for 4 days at a time. And there's going to be hundreds of people in a room taking notes, all for one little, 5 square inch area.
Yeah.
But the way that I do it, and I think most do across the country, is I do 90% of the time what's called an open approach, which means that there's a small little incision that's hidden right across this area called your columella. That's that little strip of skin and cartilage that's between your nostrils
Hmm.
towards the bottom. I'm feeling it now. Maybe that's why it
Yeah.
doesn't really help anybody listening, but
The listeners can't see, but I can see.
exactly. Just trust me. I'm touching it
Yeah,
now.
there you go.
So there is an incision there that heals really well. Of course, if it didn't heal well, we couldn't get away with doing cosmetic surgery that way, but it heals
Sure.
beautifully. And then the incision kind of extends along the margin inside the nostrils that
Hmm.
also hides really well. And so through that incision, we can gently lift the skin, the subcutaneous tissue, the muscles off of the cartilage and then towards the top off of the bone. And that's how I visualize the structures that I'm about to alter to make those
Yeah.
changes. And
So
so,
you can really see it well.
yeah, that's an open approach. And so usually the first thing that we're doing is we're bringing some sort of dorsal hump down to create that slope for a female patient or flatten things for a male patient.
Hmm.
And that's done with these little powered vibrated instruments. One's called a sonopet, one's called a piezo, but we don't break the bones anymore with
Hmm.
chisels and rasps and all those things that we used to do. And some still do, but we use more delicate machinery to kind of contour things, especially the
Sculpt it a little bit.
sculpt it. Yeah. And so that's why we get a lot less bruising than we used to back today. But
Hmm.
taking the bridge down, altering the cartilage for the tip of the nose, we're usually folding things in very conservatively, removing some cartilage because again, you don't want to be over aggressive with your manipulation of these nasal structures because that can alter the function.
Hmm.
You know, if you take out too much cartilage to get a smaller, cuter nose, but then it collapses every time they take a breath,
Yeah.
well, then again, you're losing the game. And so we're really cognizant of every move that we do. How is that changing the function of the nose? What contour is getting that? When I put the skin back down, how is overhead light casting a shadow on this structure of the nose?
Hmm.
Is the tip up too high? Is it over rotated? Is it over projected? Does it need to be narrowed or widened? All these things are part of the rhinoplasty, and we go in a stepwise function that is probably too much detail for our format, but
Yeah.
just using small sutures and manipulating cartilage without trying to remove too much, manipulating bone without being overly aggressive to get that symmetric, attractive result.
That's really great. That's very measured and carefully
Mm.
performed, clearly. If you do sculpt the nasal bones, you are taking away a little bit of bone as you do that. Do you tell patients they're at a little higher risk for fracturing the nose if they get injured?
Not really. I think it's a great question, though. I would say that definitely early on, there's some fragility to it. The first week after surgery, we put a external cast on the nose and internal splinting inside their nose just to make sure. And then
Mm-hmm.
usually my patients are taping their nose with little paper tape for sometimes a month or two after surgery, especially at night to get the swelling down.
Yeah.
And we just kind of joking to say like, hey, don't join any dodgeball leagues in the next, month or so. Like
That's right.
but they understand. And it's also kind of
That would be
like,
considered high risk.
yes, exactly. No kickboxing class tomorrow,
Yeah,
if you
yeah,
can,
gotcha.
Carol. But we really have to make it stable. And I think more patients notice that my nose seems firmer and more stable, but more inflexible than it was before surgery. And I'm like, okay,
A
good.
little stiffer.
Yeah, I want it to be stiffer because that means that it's staying that way. Now, over time, as the months pass, it will loosen up and it'll feel like a nose again. But if it's stable and stiffer and more inflexible, that means it's going to look that way aesthetically, not only next week when we take the cast off, but next year, And so
Yes.
we kind of overdo it as far as buttoning things up during surgery to account for someone holding their 6-month-old and getting hit in the head, like with,
Oh gosh, yeah.
and I can know that
Yeah.
from experience,
I can imagine.
Yeah.
Where do you typically perform the surgery, and what type of anesthesia do you use?
It's almost always done at a surgery center, so it's not
Hmm.
a hospital.
Like an outpatient kind of.
Yeah. So there's me, there's a scrub tech, a circulator, there's an anesthesia provider, whether it's a CRNA or a MD or DO, but they are administering general anesthesia. So this surgery is going to take between 90
So
minutes.
you're out.
So you're out. You're out there, your airways control, whether through, these terms, LMA or breathing tube, whatever. Because the nose, don't forget, if there is any bleeding, irrigation, any surgical fluid that we encounter during the surgery, that goes right down the back of the nose and sits right on top of their airway. So we need to control their airway during a surgery like rhinoplasty. So we're not doing twilight sedation or anything like some do for face and necklace surgery or whatever, because we are in the airway,
Yeah.
working
You
on the
got to keep
airway in real
it
time.
clear and,
Yeah.
controlled. That's a really great point. How long can the procedures take to perform?
At minimum, probably 60 to 90 minutes at maximum. And this would be for a revision rhinoplasty, which is kind of a whole surgery into itself we can get into, but that could be upwards of 5.5, 6 hours long if we're borrowing, rib cartilage, things like that are required for those types of procedures. But
Yeah.
and it's somewhere in between there. I mean, we book the OR kind of with our best guess as to how long we think that procedure would take.
Okay. You've explained a little bit about short-term recovery. Maybe tell us a little bit more about that. And then long-term recovery. And I think that kind of brings us to our third important point about rhinoplasty you wanted to tell us. Could you expand on that?
Yeah, I think that is an essential point for patients to understand before they seek out or sign up for a rhinoplasty, is that a rhinoplasty really takes about a year to truly heal from it. Now, admittedly,
Yeah.
I'd say most patients are happy with their nose well before a year, but
Yeah.
even if you're happy at 6 weeks, that's fantastic. It will look different at 1 year than it does at six
Yeah.
months, and so on.
Does that surprise everybody?
Well, now most patients are coming and they've heard people like me on podcasts, or they've like listened
Oh,
to
yeah.
Instagram,
Okay.
because we go over it again and again, but it really does take a long time to heal. And not because there's any issue with the healing process for that patient or any issue with the surgical technique. It's really because of the swelling.
Yeah.
I think the wounds have healed by then, but especially with the lymphatic system, and I
Yeah.
think we're learning more and more about the way that the body circulates lymph, how we can drain lymph from the surgical area. We have a manual lymphatic drainage specialist that we work with to kind of help massage lymph away from the nose
Really? That's
for
great.
facelifts too. That's been really helpful. But for example, if you have surgery today with me, you'd see me next week. I'll take the
Hmm.
cast off, the splints out at that point, and anybody that you'd see at Trader Joe's is going to recognize from that point, even a week or two beyond that, 2 or 3 weeks after surgery, that you've had surgery done.
Hmm.
Even
Yeah.
strangers, like your nose is swollen, you don't feel
Yeah.
like yourself,
Right.
you're self-conscious about it. And then there's a second period where it might be between 2 and 3 or 4 months before you're actually really excited about those contour changes, that it's looking more and more like the photos that I took intraoperatively before I put the cast on. But then subtle changes as the lymph continues to drain and every little, millimeter of swelling resolves, and you start to see more contour along the tip of the nose. The profile looks for women a little bit more sloped or a little bit more symmetric for men, etc. And that goes on 6 months during our final visit, 9 months. You can come back if you have any concerns, a year and beyond that. So the nose, because of the anatomy, because of all the fine detail that goes into the surgery, it takes a long time to heal from.
Yeah. Well, and it's interesting, you just talked about, it takes such a long time for that swelling to fully resolve. And a lot of that has to do with the nature of the tissues that are in the tip of our nose. I mean, it's just spongy tissue that holds on to fluid.
Hmm.
And there's only one way out. It's unlike other parts of our body where you can, fluids can flow from one side to the other. When everything is pulled out to the tip of the nose, there's no other way it can get out except from the backside. So I think those things
Oh, yeah.
partially explain why it can possibly take so long. So
And one thing, I mean, because if you have, say, you have two different patients and they're the same age,
Hmm.
the same gender, and one is a Scandinavian woman with very thin, pale skin,
Hmm.
and one is a Southern Mediterranean woman, or from the Middle East with very thick, sebaceous skin.
Hmm.
At the end of both surgeries, I would bet that their cartilage construct can look kind of similar, the way that we position the tip of their nose, the way
Hmm.
that we've sculpted the dorsum, and so on. But then we put that soft tissue back down, we close that up with sutures, put a cast on, etc., and wait for them to heal. Now, the woman who had the Scandinavian pale thin skin, she's going to have much more bruising than the other one, but she will notice those little fine details from the rhinoplasty within 3 to 6 weeks, and be happy with it then. But
Hmm.
the woman with the really sebaceous, thicker skin, that's going to, like you said, sponge up a lot of that lymphatic inflammatory fluid.
Yeah.
It's going to obscure a lot of the details. It's going to cause swelling that could last for, again, the 6, 9, 12 months and beyond before she really starts to appreciate, the aesthetic result of it. So we have to kind of bring that in when we counsel the patient ahead of time.
Yeah, so I think that's so wonderful that you do that and you really counsel people so they know what to expect. I think even if you do that, I suspect it's hard for people to accept or to remember. And I bet there's a little bit of frustration that can go along with that too.
Oh, hard for both of us. Like we
Yeah.
have a patient on our schedule today, and she's 4 months out from surgery, and I'm looking at her photos before walking the room from the OR. We always take photos
Yeah.
when they first go to sleep and then before we wake them up, to kind of see the before and after. And you're kind of expecting to walk in the room and you're ready for high fives and everything's going to be great. And then they say, I am happy 86% of the way there, but there's still swelling on the tip. And then, of course, I could see it, and it's like, you're right, that doesn't look like the way that I left it. So we have to wait
Yeah.
longer for the swelling to resolve. And luckily, again, most patients have heard me say that and they're really cool with things and gracious, but it's like I want to get to that result. I'm ready for that, final moment.
It's got to be frustrating for people because, they're as patient as they can be, but then, they're just ready to be done and you just have to wait.
For sure.
Well, would you tell us in general what factors can lead to perhaps a better or worse outcome in rhinoplasty, preoperative factors? And is there ever anyone who's really not a good candidate for a nose surgery, shall we say?
Yeah, I mean, I think I would probably divide that second question up into two different camps. Of course, there are medical issues, and,
Yeah.
and you've dealt with this too in your practice. If they are obviously, if they're a smoker, then they're not a candidate for surgery. If they are an uncontrolled diabetic, and then so on down the list for all the things that would render them not a candidate for any elective surgery, but especially for rhinoplasty that could cause the swelling to persist longer and that could lead to some complication. So that's one factor into itself, and I think patients understand that. The second factor is, you know, I think it's kind of general attitude where when they wake up from surgery, there's so much homework for them to do. There's massaging and ointment application and medications to take and the herbal supplements we give them and a cast to wear and all that kind of stuff. They have to really be an active participant in their healing process
Ah, yes.
because, like we're talking about, is one patient happy at 6 weeks, 6 months, 6 years, or so on? They need to understand going in that one, that will be a process for them, and two, they need to be an active participant because the result doesn't start the moment that they wake up from surgery. It's somewhere in the distant future after they've healed. And
Yeah.
so we really have to kind of feel them out and make sure that their expectations are in touch with reality,
Mm-hmm. Mm-hmm.
because I'll 100% be satisfied with the way the surgery went. Because if I'm not, then I'll just keep operating until it looks the way that I want it to.
Yeah, right, right.
I just want to make sure that we're both happy at 6 months or a year or whenever that day is, and they're saying, I'm really happy with the result. And you can definitely tell which patients are sticking to the script, really following the rules, and which patients aren't.
Mm-hmm.
And so we have to preferentially pick the patients that are going to stick it out with us and be part of the team and make sure that they're getting to the end. So I would say if you're not healthy for elective surgery, let's not do a surgery like rhinoplasty. And number two, if you're not up for the recovery
Yeah.
and the active participation that's going to require, then let's not do a rhinoplasty. You don't do a surgery like this on a whim, or
Yeah.
if you're on the fence, you have to kind of be up for it.
That's a great point. I would like to go back to something you said. You mentioned smokers are not a candidate for the surgery. Will you flat out tell people, I won't do that until you've stopped smoking for such and such time? And then also, what is it about smoking that would preclude someone from being a good candidate for this procedure?
I would probably say 3 months, maybe, if they quit smoking. It doesn't have to be, 10 years or that kind of thing.
Yeah.
Like we know about smoking, how impossible it is to quit. It kind of becomes part of you after a
Yeah.
while, and the two reasons why are, one, with cigarette smoking in particular. One, the nicotine itself causes vasoconstriction of these small vessels and stuff would really,
So they clamp down.
exactly. And so the wounds won't heal right, the swelling will persist longer. And when every millimeter matters with rhinoplasty, you need to maximize your chances of success, and smoking won't do that. And then number two, the carbon monoxide in the cigarette smoke itself,
Mm-hmm.
that displaces, the oxygen from hemoglobin, and so you get less perfusion, oxygenation of the tissues, and that is absolutely vital when it comes to healing
Yeah.
after rhinoplasty.
So
And
we
so,
need oxygen to heal.
yes, and so if you're a smoker and you continue to smoke during surgery and somehow it's missed, the wound there between your nostrils or inside your nostrils will dehisce potentially.
Break apart.
It will have to granulate in. It'll be an unsighted. And so no matter how the surgery goes, you can't compensate for the risks that go along with smoking.
Yeah.
It's a tricky conversation to have with some patients. And
Yeah, I bet.
also, if they really want the rhinoplasty, they leap over the hurdles with us and they quit and come back. And I've seen that many times.
Yes. Gosh. Well, how often are revision procedures required to get the desired outcome? Does everybody need a little tweaking or something to the result? And could you explain to the listeners what a primary rhinoplasty is and a secondary rhinoplasty? Is a secondary rhinoplasty different than just a little revision surgery relatively soon after the procedure?
That is a great question. Comes up a lot in my practice. Now, the revision rate, they're kind of on a gradient. I would say that 1 in 4 or 1 in 5 of our patients requires some sort of small medical intervention after, and usually it's a steroid injection like Kenalog to the area above the tip of the nose. That is where the skin is most sebaceous down there, the lower third of the nose, and gravity's pulling all the swelling
Right.
down from between the eyes to that area. And also the tip, it's such an important kind of
Yeah.
aesthetic area, and so if you don't see that, that really disappoints a lot of patients. So we do.
So the steroid will do what?
It will do two things. One, it causes collagenylysis, meaning it breaks away some scar tissue that can form in that area. But most
Hmm.
importantly, it evacuates that lymph,
That fluid. Yeah.
the fluid, yeah. And so it gets rid of swelling and expedites usually a process that would have happened anyhow, but we want it to go faster. And so again, that's probably 1 in 4, 1 in 5 that comes up during one of our many post-operative visits. I'd say maybe it's like 1 in 25 patients who require like a small surgical intervention. By small, I mean like in clinic, we're numbing the patient with a little bit of lidocaine and rasping down some bump that formed because the bone can heal too overzealously and form little,
Ah, yeah.
just like if you have a scar on your arm and it's kind of raised, if we file down the nasal bones, if that heals, it can have a little bone that forms as it heals. And so,
Yeah. Get a little too thick. Yeah.
yeah, so we have little in-clinic rasps that are designed for this procedure to kind of do some small filing.
Perfect.
And then beyond that, I'd say probably 1 in 100 where they have some true infection, structural failure, something that requires like a trip back to the OR. Those are probably the basic numbers and kind of what you can expect.
Yeah.
But, a revision rhinoplasty, and we performed one yesterday, is when a patient has had a prior rhinoplasty, say they had a surgery 15 years ago when they lived in Arizona or something, and then now they're in Kansas City and they felt like the tip was fallen or it's pulled to the left or they never liked the way that it was left, those kinds of things.
Hmm.
Those patients come back and it's a different conversation because it's a different surgery and a different healing process because when we're performing a primary rhinoplasty, we're usually using the cartilage that makes up the septum from inside the nose as sort of construction material, grafting material to make
Yeah.
sure that we can bring the bridge of the nose down to a lower point, or we can suspend the tip of the nose in just the perfect position, not too high, not too low. We want it fixated in place so it doesn't fall over time. If the patient has had prior rhinoplasty, that septum has been used already. There's scar tissue there. They need soft tissue reconstruction so you can't see, all the bits of cicatrix that were left there before and scarring. And so
Yeah.
for those patients, we're normally borrowing rib cartilage, a little incision hidden below their right breast in women or, right pec muscle in men. And that bit of cartilage kind of between your sternum and a line drawn along your nipple is usually a straight 2-3 inch piece of cartilage that I can kind of dice up and use as, again, material to reconstruct the nose in a way that it looks the way the patient wants. So there's a slight slope and a narrow tip for women or flat, straight nose for men. But you're also dealing with scar tissue. So after that surgery is done, they're kind of healing from two surgeries at once. The original surgery 20 years ago or whatever, and then also my surgery, which those are the ones that can take 4, 5, even 6 hours, and you never quite know what to expect until you open the nose, get in there, and find what kind of scar tissue or grafting the prior
Yeah.
surgeon left you.
Surprise,
Right.
good or bad.
I'm sure
Yeah.
you've seen those, yeah.
So, to summarize, can you just tell us again what is a primary rhinoplasty and what's a secondary rhinoplasty?
So primary rhinoplasty, they've not had prior surgery. All their surgical planes are pristine. I, as the surgeon, am going in for the first time, and those are usually more predictable in the healing process and the technical process intraoperatively. Secondary rhinoplasty, they've had prior surgery before, whether it's a secondary rhinoplasty, their second surgery, a tertiary rhinoplasty, their third surgery, and all the way down the list.
Ah, yes.
And each surgery adds one extra layer of complexity to it. And so for a secondary rhinoplasty, these are not impossible surgeries. We perform them often, but a patient needs to understand that it'll ask a little bit more of them as far as their patience and their being an active participant, like I mentioned, because the swelling will take longer to resolve. They're going to have two wounds to heal from, likely with their rib cartilage or rarely their ear, but sometimes, yeah.
Because when they had their primary rhinoplasty and the septal cartilage was used, that bridge is burned now and you can't go back there. You have to find new cartilage from another area, as you said.
Exactly. And requires more material because you need to stabilize more things. There's more
That's right.
scar or contracture forces trying to pull the nose to the right
Yeah.
or the left, and
Yeah.
we have to account for all those. So,
It's no longer virgin territory.
no, it's a lot of nuance. And there are some surgeons who won't offer secondary rhinoplasty. But if you really perform rhinoplasty, you need to be there for all the patients that want reshaping, I think.
Yeah, yeah. That's part of the deal, isn't it?
Hmm.
How important is it for patients to have realistic expectations? And we all know that that's not always the case. Sometimes patients will nod and smile, but they are not connecting with what you're really trying to say. But tell us about that.
Oh, it's essential. What do they say? When you tell a patient something beforehand, you're explaining. When you tell a patient afterwards, you're making excuses or something. I forget
Oh,
the actual
yeah.
term.
Yeah.
And I think patients recognize that. And so as I've gotten further along performing more surgeries in general in practice, I'm recognizing what patients understand and don't understand. And rightfully so, they get excited about it. And they're seeing stuff online, like my Instagram, which is, of course, full of beautiful results, things that I'm really proud of, and they're thinking, I'm going to go see a doctor and I'm going to pay for this,
Yeah.
because I want this one and then this one,
That's
a
going
little
to
bit
be
of this one.
me. Yeah.
Exactly. But each one of those patients went through the same process they're about to go through. And so that's my job, and my team's job to talk with the patient ahead of time and say, listen, we're going to have at least three things that we're going to talk about at the 1 month visit that you don't like about your nose. There's going to be one night, 3 to 6 days after surgery, we're going to wake up and I will get a panicked phone call because you think that the nostril is kind of asymmetric.
Mm.
Even 5 years from now, when I see you out at the grocery store or at the Chiefs game or something, we're going to look at your nose and we're going to say, oh, I love the change. Yeah, I wish this was a little bit different. I wish that there are those
Right.
things because the nose is just, that's the way that it heals. It's going to look perfect when I finish, or else I would keep going, like I said before. But there will be something about this that you don't like.
Yeah.
And I think that helps a lot because they're realizing, like, oh, okay, this is going to be a kind of a messy process. And psychologically, I need to be in that headspace where
Just how to have to accept that. Yeah.
you're not cutting and pasting from another
Yeah.
picture to your own
Right.
nose. And there's
Right.
going to be some dark moments afterwards. And I think also you probably have the same experience as patients as they recover from surgery, like their endorphins are up, they've been on steroids or
Yeah.
whatever. They
Right.
can have some dark times, like, 5 to 15 days after surgery where
Come
they,
down from that. Sure.
yeah, like maybe a little bit depressed, and that, leads them to focusing on their surgical result and so on. But we are there for them beforehand to tell them what's going to happen. Then, of course, afterwards to make sure that they know that whatever comes up, we're a team, we're in this together, and we're going to guide you through this recovery process, whatever that takes. And so it's just important to have these as much of the conversation like this ahead of time as it is to explain to them afterwards if they weren't expecting it.
Yeah. Well, you've really given us a good understanding of where we are now with rhinoplasty. What do you think would be the future of rhinoplasty? What's on the horizon? Anything new happening or anything you'd like to see happen in the future?
Yeah. One, I wish that, the surgical part notwithstanding, I think with the recovery part, if we could have better medical treatments to expedite that process, to improve the way that wounds heal, to evacuate lymph, to shorten that from a year to a week,
Yeah,
that
gosh.
would be really, really helpful for patients, whether it's some topical that's applied during surgery, some pill that's taken that hasn't yet to be invented. We're pretty up to date on everything that we offer patients, from homeopathic regimens to certain medical regimens, and some lasers, hyperbaric oxygen, red light therapy, all these kinds of things that go along with it. But I wish there was something that every patient would require that they could take to expedite that healing process. And number two, during the surgery itself, there will never be a replacement for manipulating the tissues. If you want your nose to look a certain way, it has to be altered to get that final form.
Mm-hmm.
But if there was some other material that could replace cartilage, like rib cartilage, if there was something
Ah,
that, could be invented in a lab that the patient's body would adapt with really highly efficacious results that we could just use, that would
wouldn't that be
really,
great?
oh my God, it'd be great. There are things out there. We use cadaveric rib, things like that. You've used these too,
Some from
MedPore.
a
Yeah,
cadaver and
right.
or artificial things, yeah.
But they are not perfect by any means, to
Yeah.
the point that I
Yeah.
still usually go to a patient's own rib. So those are things that would make my life, and most importantly, a patient's life, a lot easier. But we're not here yet. We'll see. They'll all be invented the day that I retire, I bet.
Well, of course, yeah.
You
We'll
know,
be waiting for all those great things. We'll be waiting. Dr. Markey, you've just been so informative today. And just for our listeners, I'm going to summarize those 3 points that you made about rhinoplasty. Number one, the nose is a sensory and functional organ, and it's an important part of our aesthetic character, but it's not just the aesthetics. You really have to keep in mind the function. The second one is that there's no right answer for every patient. It's really a customized procedure that you're performing, and there are a lot of different things that can be done to create that customized result. And the third one is that it can take a year to heal and for all the swelling to go down, and that the outcome, while we can have a good idea of where it will be, it's not always exactly predictable. And so patients have to keep that in mind. Given that, I'd like to know if you have any final thoughts you'd like to leave with the listeners about what they should expect or know about nose surgery, or just about plastic surgery in general. Anything else we should talk about?
great question. I think the reason why I like doing these podcasts and why I do these little TikTok videos, Instagram things, marketing that would kind of couch as sort of education for patients is because, and I felt this in my own practice too, that a patient that listens to a podcast like this and all your episodes you've had before me, or watches these videos online that are telling the truth about surgery, they're so much more educated and aware of what to expect, of what can happen. Of course, we do that with our promotional stuff, but also the risks
Sure.
of it too.
Yeah.
And the more educated a patient is, the safer things will be moving forward. So I love it. I love what you're doing with this podcast, educating the public about these really,
Oh, thank you.
difficult recoveries and stuff for patients, and it's to their benefit really. But it's been fun. Same time next week. Let's
Yeah.
do it again.
Okay.
Yeah,
All right, Dr. Jeff Markey, thank you so much for being with us today.
of course. Thanks.
All right, take care.
You too.
Well, that's our show for today. Hope you enjoyed it and learned something too. Don't forget to subscribe, rate, and review. Please share this podcast with someone else who might be interested. And while you're at it, check out the podcast website for related topics to explore. It's www.plasticsurgerydecoded.com. And as always, thank you for listening to Plastic Surgery Decoded.